Today we welcome Will Smart, Alcidion's non-executive director based in the UK. Welcome to Alcidion's HQ in Melbourne, Will. We are eager to gain insight into your deep experience leading sophisticated health digital transformation initiatives in the UK, and of course, what has drawn you to a leadership role within our company. Will, you've had an incredible career at the front line of digital health in the UK as a technology supplier to the NHS, an NHS Trust board member and industry leader. Can you start by sharing your experience and your motivations for joining Alcidion as a non-executive director?
As hard as it is to believe, I've worked for over 30 years in technology. So I started in the NHS in data analytics, and I've spent my time, and I've been very fortunate to have a career that's enabled me to work with great institutions, to have a job as a national CIO, and to work with a global technology company that gave me a sense of the shared challenges we have in healthcare that can be addressed through technology. The reason that I wanted to join Alcidion was I think we share values in common about the importance of digital that really supports the delivery of care, that supports the clinician and that time they spend with the patient to help them make the best decisions to drive and maximise safety. And also I think the technologies and the solutions that Alcidion have got, I think, are really important and offer real opportunities in terms of the standards-based data platform that you bring, the tools around patient flow management, for example, that really begin to address the challenge of both how do I build that data infrastructure in an institution, but then how do I use that data most effectively for the benefit, ultimately, of the patient.
Well, you're clearly passionate about improving healthcare. Why is it such an exciting time to be working at the forefront of digital health innovation on the clinical frontline?
Well, I think healthcare is the last analog industry that we've got in the world. So I think we are very close to seeing the kinds of transformations we've seen in other industries begin to happen in healthcare. And also, healthcare is the most important industry in many ways. We will all touch healthcare at some point in our lives or in our families' lives. So it's important that we have services that are the best they can possibly be. So for me, the opportunity is to actually really transform health for the benefits of the population, for the individual, and also to deal with some of the challenges we've got around the cost of care, an ageing population, multi-morbid, sicker patients. All of those can begin to be addressed through technology.
What are the most effective impacts of technology that you've seen?
So I was thinking 10 years ago, I went to a hospital in England and saw virtual care for children. So these are sick children that were going into hospital for long periods of time to be monitored by doctors. And they sent them home with equipment that would enable them to be monitored at home in the care of their parents. And that had a huge impact, both in the experience of care, but also the outcomes as well. So I think that opportunity to actually move care out of hospitals, I think, is the next phase. And I was recently at a conference in London with a chief operating officer from a hospital in the south of England who's created a 100-bed acute virtual hospital where the patient, rather than moving from an operating theatre to a ward, is now going straight home with monitoring devices that mean they can be monitored remotely, but also acute staff going to the patient rather than the patient coming to the hospital. And that seems to me to be the next big opportunity, the next big phase of transformed care.
Given your deep experience in the UK, what do you consider the standout features of Alcidion's Miya precision platform?
The challenge we have in healthcare in the UK is all about fragmentation. Patients get seen in multiple institutions and multiple facilities, and that data doesn't always flow. So a key part of what Alcidion Miya offers is the ability to consolidate and bring data together into a standards-based solution that means it can be used and utilised by other solution sets, not just our own. And once you've got that data together, then you can begin to manage the patient effectively and understand much more about the patient. So I think that's really important. I would also say the challenge that I talked about earlier is all around managing flow, about how do we improve productivity. And again, I think the patient flow tools that My Precision have, I think, are fundamental in terms of how do we drive productivity and how do we make better use of very expensive hospital facilities.
Let's now talk more specifically to the UK landscape and the frontline digitisation program. Whilst the NHS has seen a lot of political activity recently, we are continuing to see opportunities come to market in the UK. What do you consider the main drivers, and how well placed is Alcidion to be a key player?
So the key drivers of healthcare I've talked about before. It is the challenge of productivity, flow, how do we make better use of the limited funds that we've got. What we're seeing around the UK strategy for digitisation has been an ongoing strategy for quite some time. We still struggle with the challenge of how do we digitise the front line of care, and that is what the Frontline Digitisation programme is all about. So what Alcidion offers is a standards-based data platform that enables us to pull together all of the parts of the platform of care. And even though we have enterprise EPRs in hospitals, often the data is still very fragmented in silos between departments. We can break some of that down. With the patient flow, we can manage patients more effectively through the system and actually make sure that patients are seen in the right place at the right time. With AI and clinical decision support, we can make sure that clinicians are armed with the right information to make the right decisions as the patient is managed through the system. So I think we're in a great position. I think especially now as we move beyond frontline digitisation, which is about getting what I would call the data infrastructure in place within hospitals, into how do we use that data to coordinate care across multiple institutions. I think Alcidion is very well placed, again, with the kind of flow tools, for example, that will really change how care can be delivered.
That real optimisation.
Yes, absolutely.
How does the NHS's digitisation strategy align with the new government's emphasis on interoperability and unified procurement following the NHS England's merger with DHSC?
I think in many ways what we're saying politically is taking us back to where we were a decade or more ago. So we shouldn't get too excited about organisational change. But to your point, I think the government is indicating that the objective is to move away from analogue to digital. So I think we're really seeing a continuation of the strategy. To this point, when I was a national CIO, we built local health and care record exemplars, which was all about how do we bring data together. So I think the strategy in many ways is unchanged. I think there is now an urgency to it that means the new government needs to be seen to make change quickly. I think we'll see a greater emphasis on driving outcomes rather than driving technology inputs, as it were.
How is the NHS balancing the urgency to digitise the frontline services with the risks of perpetuating really inefficient workflows through that digitisation but broken processes?
The implementation of an EPR is not the end of the journey. Once you go live with your EPR or with any technology solution, that's the beginning of the journey. And I think I would liken it to a finance director saying, I've implemented a brand new finance system. My financial re-engineering here is done. I don't need to do anything else. Actually, you need to put in the infrastructure in place. Then you need to make use of it to solve real business challenges, real clinical challenges, to really improve the quality of the care that you deliver.
Thanks, Will. It was great to chat today. It's always deeply fascinating to gain insight into how our key markets are embracing the digitisation of healthcare and clinical workflows. We really appreciate the time and expertise you are contributing to our team. A reminder that Alcidion is publicly traded on the Australian Securities Exchange under the ticker code ALC. Thanks for tuning in.